Hi everyone. I am happy that February is designated National Children's Dental Health Month. Dental health is a critical component of overall health, and it deserves our attention. And for a long while, it didn't receive enough public attention. Seeing our children laughing and flashing healthy smiles is important in so many ways. Besides the confidence that comes from a big smile, healthy teeth are a part of good dental hygiene and part of the larger social and emotional development of children. Unfortunately, lack of good dental care is still a serious concern for children in West Virginia and the nation at large. I have long advocated for policies that provide our children with good dental coverage and access to dental services. As I think many of you know, I first came to West Virginia as a social worker, a VISTA worker, in 1964. Working in the small community of Emmons, West Virginia. When I arrived, I was shocked to learn that there was absolutely nothing that school-age children living there could get in the way of dental care. They'd never been to a dentist, never heard of a dentist, there was no dentist service available, and it was heartbreaking because you saw teenagers who already, their mouths were beginning to just kind of get bad. Anyway, we worked, and we couldn't sustain this because it wasn't a big enough program, but we worked to get a bus to bring children to this Tiskawa grade school in Charleston to receive dental care. And since my days in Emmons, I've continued to work to raise healthcare standards, and this includes dental care. I remember the dentist, after he checked some of those young teenagers over, he said, "Jay, it's a nice thing for you to do to bring them here, but it really is much too late. If you don't get the baby teeth right, anything else that follows is going to be bad and get worse." So we have made many advances in healthcare since then, but dental health remains a very serious challenge to us. Far too many children have preventable cavities or lack of necessary dental sealants that can help prevent cavities. As many as 65% of West Virginia children age 8 have experienced both tooth decay, and tooth decay goes completely untreated in 35% of children between the ages of 6 and 8. Those are statistics, but those are bad statistics. Dental visits should be a routine part of growing up, just like it is with pediatricians, which is why I championed for the reauthorization of the Children's Health Insurance Program, which I helped write a couple of decades ago. Now, that program requires that states provide dental coverage for all children enrolled in the Children's Health Insurance Program. It's as simple as that. It's part of the law. This legislation also provides for the prevention of childhood tooth decay, the most common chronic childhood disease, which is incidentally 5 times more common than asthma and 7 times more common than hay fever. No child should go without comprehensive dental coverage. For that reason, I recently joined my Senate colleagues in sending a letter to Kathleen Sebelius, who's the Secretary of Health and Human Services, the top health person in the cabinet, asking her to help to make certain that our children have access to affordable dental coverage in the new health insurance exchanges starting up in 2014. That's a couple of years off, but not too early to plan on putting health coverage for teeth in there. I remain committed to making dental coverage a reality for all of West Virginia's children and for children everywhere in this country. And I want to send my gratitude and appreciation to the many organizations and agencies in West Virginia for all that they do, that you do, to make sure that our children have access to dental health services. These partnerships are very important to improving the dental health of our children. Children don't like to go to dentists, but children need to go to dentists, and they really, really, really do. It's a serious problem. We are making strides in dental care here in West Virginia, but there still is so much to do. Health care and dental care should never be thought of as a luxury. Let's all work to raise awareness about the importance of oral health, starting with the first few years of a child's life, to see them grow into strong and healthy adults. So our work is important, and I thank you.